Previous society guidelines from the AHA and SVS indicate that a vascular evaluation, we touched on this at the beginning, that a vascular evaluation to restore inline flow should be performed prior to amputation. But as you know, despite that more than 60% of all amputations are being performed without either a vascular evaluation or an attempt to restore inline flow prior to amputation. What is the 2024 statement or guidance for pre-amputation protocols?
100%.
Anything definitive?
Yes, 100% is a class 1 indication in the guidelines that every single patient that is scheduled to undergo amputation should have some form of a vascular evaluation, some form. Whether you want to do ultrasound, do a duplex ultrasound. You want to do ABI, do ABI. You want to do a CAT scan, do a CT angiogram, do a CT angiogram. Whatever it is, MRI, do MRI. If you want to do an angiogram, do an angiogram. But we should not be amputating the patients without understanding what is the level of the blockage, what is the perfusion looks like, and that is there anything that can be done for them? Because even if they need an amputation, the level of the amputation, there's a lot of stuff, we don't have time right now, but maybe next time we can talk about that, because it's not just, okay, there's a difference between getting a toe amputated, when you're getting a below knee amputation, or getting an above knee amputation. These are totally different amputations. So even when you have agreed that we need an amputation, the level of the amputation and the functionality of the amputation is extremely important. And having an understanding of the blood flow and whether that kind of amputation is going to heal or not, and what needs to be done to minimize the level of amputation, and how we give a patient a functional amputation are extremely important, Kim. So, and those are the kind of things that diagnostic workup will give us so that we understand. So I don't think there's anybody out there that can argue with this one, that every patient needs to have some kind of evaluation.
Yes, I mean, even now there might be a few exceptions. If there's someone that has an acute situation, sepsis is spreading, they might go straight to just cutting off the problem.
Oh, of course.
Life is on the line.
Of course. If somebody has a septic foot, of course. we are not talking about gas gangrene. We're not talking about a wet gangrene. We're talking about routine. We're talking about outpatient, CLI, we're not talking about acute limb here and, threatened limb. So yes, you're absolutely correct. We want to make sure that, that those patients, everybody agrees that, they need imminent amputation because they're going to lose their life. But for the other 98% of the patients, we need to do a diagnostic workup.